I think that our Committee on Advancing Safe and Equitable Obstetric and Gynecologic Care really wanted to bring this particular population into the center, given everything that's happening in our country, and wanted to reaffirm the ways that OB-GYNs specifically can take an active role in supporting and advocating for this particular population, given some of the current changes in federal policy that really impact their health and well-being. Yes, thank you for that question. That is something that we introduced in that committee statement that was published last week. And really, immigration informed care is cultivating an awareness of and responsiveness to immigration related health risks and concerns. Simply put, it means really seeing patients holistically within their life context. Some examples that we mention in the statement are around recognizing a patient's migration journey. So, whether their journey was voluntary or forced, can really shape their physical and mental health outcomes, as well as their access to care and their sense of safety in clinical spaces. Immigration informed care also means understanding that immigration related stressors, such as trauma, family separation, language barriers, fear of deportation, and limited insurance options, really have an important impact on the patients that we see in our clinics. And there are opportunities for us as OB-GYNs to proactively address those and how they may affect the health and well being of our patients. In practice, immigration-informed care is an approach that avoids assumptions about immigration status and prioritizes patient autonomy, respects cultural and linguistic needs, and also builds trust by creating safe and inclusive clinical environments. At its core, immigration-informed care really treats immigration status as a potential source of vulnerability, but not as a label, and delivers care that is trauma-informed, rights-affirming, and explicitly welcoming. Absolutely. There's actually a lot of things that we can do to help make our spaces more welcoming and trustworthy. So, first, I'll just say that from the moment a patient enters a clinical space, they make a conscious or unconscious assessment of how comfortable they feel in that space, just like we all do as we sort of go about our lives. So, having displayable, visible signs of inclusivity, such as safe space messaging or multilingual signage, and clear information about patient confidentiality and rights can be really important just to set up that space to be as welcoming as possible. I would also recommend to my colleagues that we all be cognizant about the artwork that we put on our walls and how it may be perceived or how people are portrayed, because that's also an important aspect of patient experience in terms of how, when people enter our spaces, how they feel, whether they feel welcome or seen, and how comfortable they are in that specific clinical area. One of the most important things that we can all do to make our clinical spaces more welcoming and trustworthy is to ensure qualified language access for all our patients, which means having high quality, timely, professional medical interpreters at all points of care and not relying on family members or ad hoc interpreters. And I really want to emphasize the all points of care piece. And this includes from scheduling appointments to delivering lab or test results to wayfinding in clinical spaces. All of those little moments of communication really also require full language access, not only the face-to-face clinical encounter. As for our communication with patients, we should always be using trauma-informed communication by explaining each step of the visit, asking permission before exams, encouraging patients to bring support people into the visits to make them feel more comfortable. Also having some transparency with patients about what documentation is not required in coming into healthcare spaces. So not requiring proof of immigration status for essential services where applicable, and clarifying when personal information will and will not be shared. It's also important that we train all of our staff. So that includes front desk staff, administrative staff, as well as the clinical team on aspects of cultural humility and responsiveness, avoiding stigmatizing language, supporting mixed status families, and recognizing the impact of immigration enforcement on health seeking behaviors. It's also important that we consider flexible scheduling models and ensuring sort of wraparound financial counseling services for patients who might face transportation barriers, work instability, or lack of insurance. And I would just say, above all, one thing that all clinicians can do is simply to take an interest in their patients' personal lives and struggles. And that will really help build trust so that they might feel comfortable sharing some of the more difficult issues that they're navigating, whether they're immigration related or otherwise. And on a related note, clinicians should really get to know their community resource specialists or social work department or local community-based organizations so that they can best refer patients appropriately to resources when a need arises.